Good afternoon to all. World Cancer Day is an international day marked on 4th February to raise awareness on cancer and to encourage its prevention, detection, and treatment. The primary goal of World Cancer Day is to significantly reduce illness and death caused by the cancer. In this aspect, Yenepoya Naturopathy and Yogic Science College and Hospital organizes a webinar on integrating yoga in cancer care, an evidence-based approach. I, myself, Dr. Shreya, lecturer cum RMO, welcoming everyone to this program. I take this opportunity to welcome and introduce our today's resource person, Dr. Inbarat G, PhD scholar, Department of Neurophysiology, NIMANS, Bangalore. Sir, Sir has completed BNYS from MGR Medical University, Tamil Nadu. MD Clinical Yoga in 2015 from RGHS Bangalore. Currently pursuing PhD entitled Effects of Integrated Yoga Therapy on Cognition and Cardiac Functions in Patients with Breast Carcinoma Undergoing Chemotherapy in NIMANS, Bangalore. Sir has worked as Junior Research Fellow at St. John's National Academy of Health Sciences and as a Research Medical Officer in Zindal Nature Cure Institute. Sir has published more than 9 research articles in the international journals and written chapters for the books and reviewed articles. It's our honor to have you as a guest speaker for today's event. Sir, session is yours for enriching the students and participants. Over to you, sir.
Kind introduction. Am I audible?
Yes, sir.
Okay, ma'am. Yeah. So I to accept this invitation from Yenepoya University, and I personally thank the principal in charge of your institute, Dr. Puneet, for giving me this opportunity. And I also thank Dr. Mahesh Jan, who is also where they more than 400 students from Anna Institute is also watching. So welcome all from Yenepoya uh, uh, to participate in this National Cancer Day, and we can just try to understand and learn how yoga has been played a major role in treating cancer patients, and scientifically how we could able to integrate yoga in cancer care can be spotlighted in this talk. So presently, I'm doing my PhD in the area of yoga and cancer, especially in breast cancer. We are also trying to integrate yoga in breast cancer care and help participants to get this compared to not. Once again, there is a connection problem. I will be reconnecting again. Once again, be online. I'll be sharing my screen now. Okay, I think it is visible.
Yes, sir, it is visible.
Okay, ma'am. Yeah. So we will go into the talk. So I will be for the next 1 hour. I will be covering about how we can integrate yoga in cancer care. So all my talk, what I am going to present to you is fully of evidence based, which I have taken from the facts, and there is no words which I personally created, but it is everything which is taken from the literatures which is already been published. Okay, so the content of today's talk will be like, so first we will just try to understand what all the frequent questions which is being asked in the field of yoga and cancer research, since you all are coming up or joined for the BNYS, and you are more enthusiastic to understand how the interventions like yoga or naturopathy could able to help the clinical population, in which now exclusively we will just try to learn about yoga, its effect on the cancer care, and what are the frequent questions what we can expect from the general population. Suppose if as a doctor, once you go out after finishing your BNYS, so people who are outside will be asking you certain questions which is related with yoga and cancer research. These questions I have just tabulated it, and we will just try to answer those questions in terms of proper literature search. And then I will be just telling an overview of research which has happened in cancer. Then we will be touching upon certain yoga programs which is being carried out in different institutions around the world and different organizations around the world. And then we will be touching exclusively the researches which has happened in breast cancer. And in breast cancer, we will be seeing about the research happened in patients while they are undergoing treatment, and also yoga, which has been given for patients who have completed the treatment. That is for patients who are survivors. And we will be ending the talk with the conclusion. Okay, so this is the layout of my 1 hour presentation. So first we will go with the frequently asked questions what we might be facing in the community. Okay. So the first question what people will be asking you is like, can yoga cure cancer? So what might be the answer? Can anyone from the audience, can you tell me the answer? Or you can just tell to the representative so that she can tell me, and we can go with the further things. Anyone? I need just one answer from your side. Can yoga cure cancer? Please. The coordinator can talk. The coordinator, please take the response from the audience, and you please tell me. Hello? Can I get one answer? Hello? Hello? Yeah, please. Am I audible? No, let this session be
Yes, sir,
let
you are
be
audible.
interactive. Yeah, please tell me one answer. One answer I just need. Can yoga cure cancer? Hello? Hello? Okay, fine. Okay, fine. So we will go with the presentation. You can mute on your side, please. Hello. Please mute on your side. I think Yenepoya or Annai. Please mute your mic. No, there is an echo.
Hello?
Ma'am, please mute your mic, ma'am, so that. Yeah, done. So we will be going with the talk. So can actually yoga can cure cancer? The answer is currently there is no scientific evidence to prove that yoga can actually cure cancer. There is no proof as such, but researchers are believing that yoga is helping a lot in the faster prognosis. Like yoga might be actually giving a very good intervention effect, but it has not been scientifically studied. So till now, it has not been scientifically studied, and we can tell there is no cure with yoga for cancer, but it helps in the faster prognosis. Okay, but then where in which dimension yoga has been used in cancer is like most of the researchers around the globe, they are using yoga as a supportive care, okay, or they are using as an adjuvant or a complementary, which is like yoga is being used as an additional intervention along with the conventional care. For example, if the people is undergoing chemotherapy or radiation, along with chemotherapy, yoga therapy also will be clubbed so that patient will get a faster prognosis. Okay, and the second thing is like, what is the goal of yoga research in cancer care? Okay, so when you look at cancer in a larger dimension, like cancer itself is having lot of disabilities which is inside. Okay, so if you look on a broader level, cancer itself will cause lot of psychological symptoms, okay, which include stress and anxiety, and it can be a depression also. So the simple thing is like when a person is being diagnosed with cancer, the first thing which attacks him is stress levels and the anxiety, and he will be going into subsequent stages of depression. So this per se will have a lot of augmented effect on cancer, which is going to hamper his prognosis. Okay, and the second thing is physically the person will become very weak, his sleep will be disturbed, and he will be having lot of pain, which has been associated with cancer. And when you look into the deeper components, like cancer itself will reduce a person's quality of life. It will uh, make a person to, the cancer diagnosis will make a person to think a lot, that he will be thinking what is the purpose of his life. Okay, because he will be in a state where his life will become a question mark, whether he will be surviving in the future or not. So all these dimensions in cancer which has been clubbed in the person's diagnosis will have lot of impacts. So researchers has been working on these dimensions. Okay, 1 second. So researchers are working on these dimensions, which is expected in cancer population. So they are trying to club yoga in the conventional care, and they want to reduce these symptoms which are associated with cancer. Okay, this is the ultimate goal of yoga research in cancer care. And another dimension how yoga is being used in cancer population is like the treatments what they are undergoing. Okay, let it be cancer chemotherapy or radiation or surgical intervention or any form of intervention which the patient is undergoing. That intervention itself will have lot of side effects. Okay, for example, if a person is undergoing chemotherapy, starting from his hair till the tip of his toenail, almost all the organs and system in his body will be affected. So yoga or any lifestyle intervention could be a very effective treatment in addressing those side effects which is coming because of the treatment. So basically you can see there is lot of symptoms which is associated with the treatments. So you can see they will be having pain, fatigue, nausea, vomiting, insomnia, or they might be having some cognitive problems. So yoga has been scientifically proved that these symptoms which are associated as a side effect during the treatment can be reduced. Okay. And another common question you might be encountering in cancer research is like, what type of cancer represents the most significant share in research? Okay. So when you look at the statistics in yoga and cancer research, we could able to see like most of the research in yoga is being done on breast cancer. So breast cancer research and yoga is the topmost level of evidence which has been created. And in the last few years, or in the last 1 or 2 decades, we could able to see yoga is also been is also been used to address different types of cancer, which include colorectal cancer, leukemia, lymphoma, lung cancer, and also prostate cancer. Now we will come into what kind or type of yoga is being used in all these studies which has been published. Okay. So basically, the studies which has been published in these area is like we all know that primarily cancer patients will have a lot of limitations because they are almost fragile. They are in the form of excess fatigue. They are in the they will be having a lot of pain. Mood wise they are down, and so we need to consider all these factors. And uh, the practices have been designed for those individuals. Like most of the studies have used gentle practices that are less stressful to the body and which are less challenging to them. Like chair yoga has been used in a lot of studies for cancer. Restorative yoga has been used, especially breathing practices, that is pranayama has been exclusively used, meditation and relaxation. So these are the most common modalities of yogic interventions which is being given in a lot of yoga researches which is being published. Okay. Okay. Now, when we look into what yoga protocol is being used in these studies, is most studies used a regimented protocol, which these regimented protocols are conducted in group classes. Okay, so 1 or 3 classes in a week has been conducted, and most of the studies also have used regular home practices where patients do yoga for about 15 to 20 minutes a day, watching a demo video from the project which has been given to them. Okay. So most of the studies have used a regimented, that is a validated protocol, and these classes have been conducted in a group sessions. And once the treatment has been over, after the patient goes home, they have practiced yoga in the home by seeing certain video demos which is given to them. Okay, so this is about the common questions which people might be expecting from you once you pass out. And now we will be just looking into an overview of research which has happened in yoga for cancer. Okay, so if you look on research on yoga for cancer, this research has been broadly divided into 2 segments. Okay, so yoga has been given for patients on bed. That is when the patient is being admitted in the hospital or when they are undergoing treatment like radiation or chemotherapy or after surgery or before surgery. So yoga has been given for the patients during their hospital admission and during their treatment is one set of research scenario. And the other set is like the patient after completing all modalities of treatment like chemotherapy, radiotherapy, and after they go home, those people who are called as survivors, in those survivors also yoga have been taught to them, and evidence have been created. So in the subsequent slides, we will see like how yoga has been given to patients and how yoga has been given to survivors and what all the evidences which has been generated in this population. Okay. Now, when we look, first we will be talking about this patients, okay, for about 20 to maybe 20 minutes. Then later for about 15 minutes, we will be talking about survivors. So first, the session will be going in patients. So we can able to see, like this is a screenshot which is taken from the National Cancer Institute website, where it has been believed that coping with cancer itself is a very big deal. Okay, so once the patient has been diagnosed with cancer, along with cancer, his feelings is also been attached. Okay, his feelings is also been attached. You could able to see once the patient is diagnosed, the person will be wondering like what will be my survival age, like how long I will be able to survive, and their normal routine is getting disturbed because of repeated doctor visits and the treatments which they need to schedule, and the medical treatments or the medical terms which they will not be understanding. So they will be meeting the doctor, but a lot of medical terms will be used which will not, which they can't able to understand, which will further make them so much stressful. And also they feel like they can't do the things what they could able to enjoy before, and they will feel helpless and lonely. So when I am trying to read it, it might look very simple, but as a cancer patient, if these kinds of issues what they are facing is it's really dreadful, and which is be really painful event what the cancer patient has been undergoing. So till now, there has been no intervention or any kind of modalities have been shown to address these kinds of side things which clubs along with the cancer. So with the literature, we could able to see yoga is such a beautiful intervention which could able to address this feeling. Okay, because yoga has been done with a form of acceptance, and yoga has been is a form of a holistic approach where your mind and body and your breath and every it's almost it's work with the coordination. So the first thing like even in SVasa like Nagaratna ma'am, Nagendra ma'am, they used to tell like most of the problems in a disease will be over when a person accepts it. Okay, so if a person accepts that he has the problem, he could able to about 20 to 30% of problem he could able to come out of the situation. So yoga and these kinds of intervention will make a person to understand about himself, what is the purpose of his life, and his how he could able to accept it, and the future days how we could able to spend with this can be well tailored. Okay, and this you could able to see when yoga for cancer patients, as I told, the cancer diagnosis itself is having lot of side effects, that is starting with stress, trauma, and reduced quality of life purpose. And this is the thing which I have already told in the previous slide, like along with yoga, along with cancer, there are many side effects which will be clubbing with cancer, and the treatments what they are undergoing also will have lot of side effects. Those side effects also is giving a lot of reduced impact on their quality of life. Okay, so the upcoming slides or the studies which has been published in yoga for cancer patients has tried to address all these consequences which has happened because of cancer, and the consequences which has happened because of the treatment side effects. Okay, now in a overall in a nutshell, if you want to understand, like this is a broader view how yoga could act on a cancer patient, on an individual, is like we all know that yoga practice is yoga is like an ocean which has a lot of modalities which is being clubbed inside. So we all know yoga has different asanas, it has breathing techniques, that is pranayamas, it has relaxation techniques, and it has meditation. Apart from that, it has many things like counseling and other things. But here I have highlighted which is being used in research aspects. Okay, so we could able to see like these practices have shown to improve a person's physical stability. It is not in terms of cancer and other things. Overall, if you could able to see, studies have shown yoga helps in improving a person's flexibility. It improves his strength, coordination, or his balance. It improves a person's respiratory function, and it also improves a person's self-efficacy. This can be viewed in terms of physical. Okay, just by looking at a person or in a physical dimension, these improvements have been shown with the practice of yoga. Now, when we go a little bit deeper in terms of your mind, so yoga has been shown that it helps in regulating your stress, it helps in regulating your emotions, it helps in creating resilience, which means like how effectively you could able to bounce back from the stressful level to a normal level. Okay, so a person who's having a very good resilience, he's having a very good ability to bounce back to a normal state from a stressful state. Okay, so yoga has been shown to have a very good resilient power, and also it improves the self-efficacy in terms of mind level. And little more in depth, if you want to go in terms of consciousness or in terms of inner perspectiveness, it has been shown that many studies have shown yoga helps to improve a person's attention. Okay, it improves his mindfulness, it improves a person's concentration, cognition, and metacognition. So metacognition is a very good it's an upcoming term in research. Like metacognition is like it is like a person could able to understand about himself in which direction he needs to go. Okay, so cognition is like your general ability to think, learn, your memory, everything. Metacognition is a little in the upper hand, which you can comprehensively think what is good for you and what are things which you need to accept and what are things which you need to remove from yours, your mind or from your mental thoughts. Okay, so yoga has shown to improve a person's metacognition, and at the ultimate level, you could able to see yoga which helps in uniting a person's with the that is individual soul with the supreme, which is in when we talk in terms of spirituality. It improves the flow, it improves transformation, and finally it gives a meaning or the purpose of your life. So all these things, that is your physical dimension, your mental dimension, as well as your spiritual dimension, will improve a person's global human functionality. Okay, so you could able to see when a person is getting improved in all these dimensions, his level of gross level experience, that is his physical and mental health, will be uplifted, his physical performance will be uplifted. At the deeper level, he could able to have a control on his stress and emotions, he could have a control on his awareness and metacognition, and at the deepest level, his positive behavior or wellness or his life purpose or meaning will be achieved. Okay, so this is in terms of yogic perspective, or in the yogic literatures, what it is trying to convey, and which has been scientifically proved with literature evidence. Okay, and here you could able to see this is a beautiful diagram which tries to show, especially in how yoga acts in the cancer population. So it has been said that yoga or practices which is involved in yoga, especially breathing and meditation, as well as the asanas, is been shown to act in multiple dimensions of your body. The first thing is it is acting on the suprachiasmatic nucleus, which is related with your circadian functioning, and it also acts at your hypothalamo pituitary adrenal axis, where your autonomic nervous system functioning is being modulated. And also yoga acts at the level of your circulatory and lymphatic system. So all these three systems, and also you can see yoga is having stability on your muscle, that is the muscle strength, ultimately improving a person's physical fitness. Also, yoga has been acting on your cardiorespiratory performance to improve cardiopulmonary functioning. Okay. See, the circadian rhythm has shown to improve or stabilize it brings back a person's circadian to a rhythm to a normal level. It reduces his stress levels. Also, it improves or it modulates the immune function. Overall, you could able to see these are most of the side effects what cancer patients will be undergoing. They will be having sleep disturbances, which yoga have shown sleep disturbances can be reduced. Cancer related fatigue is another problem what cancer patients will see. That also has been reduced with yoga. Their cognitive abilities have been improved with yoga practice, and psychological distress has been reduced with the practice of yoga, and musculoskeletal symptoms also has been reduced with yoga. Okay. And you could, this is a very beautiful study which is been done in the United, I think it is in Holger Kramer paper. So, yeah. So, see, this is a paper which is published in 2017, which has done a national health interview survey in which they wanted to understand what is the prevalence of use of mind-body interventions like yoga, or there are many different mind-body interventions are there. So this group of scientists, they are interested to they are interested to know what is the prevalence of this mind-body intervention in people who are diagnosed with breast cancer. Okay, so the results showed that among women who were diagnosed with breast cancer, 25.2% have used mind-body intervention in the past 12 weeks. Okay, so that is even before a person is getting diagnosed, they were been practicing yoga regularly, which really shows that the importance of yoga in a person's life. Among this 25% people who were aware about yoga, about 14.3% have done spiritual meditation, 9.6% of people have done yoga, and about 4.3 have done mindful meditation. So these were the most commonly used mind-body approaches in the women who have been diagnosed with cancer. And when the doctor team has been doing the interview with them, so they have told that this kinds of practices have been told to them by their treating physicians. They have seen this kind of treatments in uh, like through their friend circle or many things. And also they have shown there are a lot of books also is been available in the market which they have purchased, and they have been practicing yoga with the guidance of yoga instructors. Okay, so here you could able to see, like there has been a lot of yoga uh, related magazines which has been available. So this snap is taken from Amazon and Flipkart. So you could see there is a lot of awareness which has been created, like the significance or the importance of yoga in treating cancer, and especially in breast cancer. So even in the interview also, people have told there is a lot of books which they have read, and with the help of their treating doctor as well as with the help of their yoga teacher, they have been regularly practicing yoga. Okay. And this is another beautiful study which wanted to understand what is the awareness of yoga among the medical people who are treating the patients. Okay, so this study is, it's a survey which is done on patients, and this is a study which is done on healthcare individuals. Okay, so healthcare individuals like people who have done a doctorate in medicine, who are assistant physicians, who are a registered nurse, and almost all people who are related with the clinical scenario in a hospital, those people uh, underwent an interview. Okay, so in that interview, they told that about 43% of the healthcare workers, they told that they were unaware that yoga and meditation classes were offered through the cancer center, and 55% responded that they rarely or never recommend yoga for the patients. Okay, so that is it is like on the baseline, the people, the team have told that 43% of people were unaware, and 55% of the people, they have told that they never used to recommend yoga for patients. Okay, so what the team of research, the scientists have done is, for these group of doctors and the physician healthcare workers, they gave a brief presentation about the benefits of yoga and meditation for cancer patients. Okay, so this is the chart which is there before presentation, and this is the chart after presentation. So after a brief presentation about the benefits of yoga, about 90% of providers stated that they could be more likely to recommend the services of yoga to their patients in the future. Okay, so this is what it's very important for our field also, that we should scientifically understand how yoga is having an impact on the patients and how it could able to help the clinical population. So that allopathy are not against any kind of interventions. It's they are being grown with a form of evidence. They need evidence. Okay, if evidence is being properly presented to them, they will be in a form of accepting any form of intervention. So the same thing which has happened in this study also. So they were unaware actually. They didn't. They were not against yoga. They were not against any form of intervention. They openly told they were unaware. But after a brief presentation, about 90% of the people strongly agreed. Okay, you can see 80% people have strongly agreed they will be giving the yoga intervention to their patients. Okay, so this is another study which deals with cost cutting. Okay, so you could able to see there is, in this study there are two group of patients are there. Okay, so one group of people, they were undergoing a routine cancer treatments. Okay, they are like how a person will be going treatments in the normal cancer hospital. So the same kind of picture has been going on. This is a group of people who have taken uh, that is yoga practices along with the medication. Okay, so you could able to see like that amount spent on this particular group, the total amount spent is about triple eight, that is $888, and here you could able to see the amount what this group of people who are doing yoga along with the conventional care, the amount what they have spent is only half a percent. Okay, and you could able to see there is a significant difference if yoga has been clubbed with the conventional care. And also you could able to see the anti-anxiety or the type of medications what they are using in the normal group is about 5. The amount what they have spent is 5, whereas in the yoga group the amount what they spend for anti-anxiety medications is very less. Also the anti-nausea medication, the amount spent in the yoga group is very less. Also the opioids or the analgesic, that is the painkillers. So this clearly shows that if yoga is being used as an augmented therapy along with the cancer care, people could able to save lot of money. They could able to preserve their health much better without having lot of side effects. Also, the prognosis rate also will be much faster compared to the people who are not doing any form of intervention and they are believing only on the conventional care. Okay, so the picture or the final message what the paper conveys is like yoga is been a very effective interventional approach which all hospitals or throughout the globe it should be used as an adjuvant approach, not only for cancer. Yoga should be used as an adjuvant approach for almost all forms of illnesses what the patient might be undergoing, to have a better economical control and also to have a less side effects and to have a faster prognosis. Okay. Now we will go into the next aspect of our talk, which I have already shown in the content, that what kind of yoga programs have been conducted in various cancer centers. So you could able to see in United States, that is in New York, there is a hospital called Memorial Sloan Kettering Center. Okay. So this is the first and the largest cancer center in the world. They are using yoga as a very effective adjuvant approach in their treatment protocols, where patients have been made mandatory to do yoga in their clinical services, and also they have a separate web portal where yoga appointments needs to be, where the appointments and slots needs to be fixed, and along with the conventional care, yoga is also given as an adjuvant approach, which is a mandatory thing. For it depends on patients to patient, depends on the severity. The mandatory, it is become it will be taken as a mandatory thing. Okay. And another thing you can see, like there is a hospital like that is in Albert Einstein Cancer Center, which is also a world's renowned cancer institute, which has also been using yoga as an integrative approach. And presently, the institute that is under the University of Texas in Houston, that is MD Anderson Cancer Institute in the United States. So currently, this is one of the largest and the world's renowned biggest hospital, which is using yoga in an exclusive manner, and lot of researches around the globe is happening in a larger scale. Like Dr. Cohen and very eminent scientists work in this institute, and they are generating a lot of evidence-based results for results in yoga for treating cancer. Okay, and apart from these institutions, you could able to see there is lot of institutions around the globe, especially in the United States, where yoga is being used as an adjuvant approach for treating cancer. Okay, so what I am trying to convey to say is like after your course or after your BNYS or MD, you have lot of opportunities where you can go and work in these institutes around the globe and help the humankind. They are actually welcoming people, especially they might be interested in a person from India, because yoga is a culture which is originated in India, and a person who is from the Indian culture, they might be interested to hire you people into their research activities and into the clinical services. Okay, so you please have hope and do your best in your studies, and you could able to reach higher positions in your life. Okay, so these are the hospitals what I have told. So these are certain screenshots which I will be showing. These screenshots have been taken from the hospitals which I have shown before. So this is the MD Anderson Cancer Center, where they have a separate window, and they have a separate. They are also publishing a blog in yoga. They regularly release some e-magazines in their website, and they really tell the importance and significance of yoga in treating cancer. Okay, and this is the first thing what I have shown, that is the Memorial Sloan Kettering. So here also they have a separate a web portal for the giving or saying the importance of yoga and the integrative approach of yoga in the conventional care. And this is the National Cancer Institute, which is NIH, where the Center for Cancer Research. Here also they are propagating yoga, and they are telling the significance and importance of yoga in for the clinical people. Okay. And this is the American Cancer Society. Here also they are telling the significant importance of yoga. And you can able to see that the Canadian Cancer Society, here also they are recommending what is the significant importance of yoga. Okay. So it is really very good that all top institutions and people around the globe, they are very much interested and they are believing that yoga is really helping. And scientifically also it has been proved that yoga is having its unique effect. Okay. Now with lot of researches and evidences, there are multiple systematic reviews and meta-analysis also is being published in the field of cancer, which we will be just brushing upon. Okay. So what all the reviews on yoga for cancer care? So you could able to see this is a beautiful paper that is a systematic paper which is trying to tell yoga for the management of cancer related toxicities. Okay. So what this paper conveys is low intensity form of yoga. Okay, either it can be a form of restorative yoga or chair yoga or simple relaxation techniques or pranayama. Especially like as I told, gentle hatha yoga, restorative. These practices are very feasible. They are safe and effective for treating the side effects, that is the sleep disruption, cancer related fatigue, cognitive impairment, psychological distress, and musculoskeletal symptoms in cancer patients receiving chemotherapy and radiation. So this is a very good evidence which has been created from a lot of individual papers which has been published, and this is a review paper. Okay. And here is another review article which says that yoga for symptom management in oncology, a review of the evidence base and future directions for research. So in this study, they are highlighting that findings demonstrated that efficacy of yoga is shown to improve a person's overall quality of life during and after the cancer treatment, and especially fatigue, which was one of the most commonly known side effect in cancer treatment, is being effectively addressed with the help of yoga. That is, improvements in fatigue has been achieved with the practice of yoga. Also, studies have shown that yoga can improve a person's stress levels, reduce disturbances in sleep, and improve cognition during and post treatment. Okay. And several RCTs provide evidence that is randomized control trials provide evidence that yoga may improve certain biomarkers related with stress. That is, it can be a cortisol or any blood related biomarkers have been shown to get modulated with the practice. Also, yoga reduces inflammation and it has shown to improve immune function. And this is another study that is a literature that is a review, which has shown that effects of yoga-based intervention on cancer-associated cognitive decline. Okay, so this study have highlighted that yoga is a one complementary therapy that can help patients resume their lifestyle prior to cancer diagnosis. Okay, so this is a very beautiful line. You can see yoga is a beautiful, or it's a one complementary therapy that help patients resume their lifestyle prior to cancer diagnosis by improving a person's cognitive function. Okay, so this study, that is this systematic review, have shown the importance of yoga in cognitive abilities. Okay. So with these backgrounds, these what I have seen is it's an overall picture. Now we will be seeing the scientific evidence which has been created for breast cancer. Okay, because a lot of studies have been published in breast cancer. So here you could able to see in this particular systematic review, they have seen that yoga intervention could reduce a person's disability. It has shown to reduce lymphedema and fibrotic changes of the joints and the muscles. It has improved the person's range of motion and the mobility, and it has improved the person's overall quality of life. Also, there is a lot of systematic and the meta-analysis which is there in breast cancer population, which has shown yoga classes can reduce fatigue in breast cancer patients remarkably. And this is another beautiful study which is done in sleep. Okay, so basically we know that the cancer diagnosis as well as the treatments what the person undergoing is going to affect a person's sleep in a greater extent. Their sleep will be completely destroyed. Currently, if you look on the alternate approaches which is being used to address this sleep disorder, is one is cognitive behavioral therapy for insomnia, that is sleeping problem, mindfulness techniques, and yoga. These are the three most commonly used behavioral interventions. Out of these three behavioral interventions, yoga has been shown to have an upper hand. Okay, so yoga is shown to have an upper hand in having a more beneficial effect. Also, it has fewer side effects. And this is another study which has been compared that yoga with the physical intervention. Okay, that assessing yoga specific effects relative to another any other physical exercise interventions like aerobics. When yoga intervention and aerobics or physical exercise is being compared, it has shown that yoga marginal have shown a significantly marginal improvement compared to the physical exercises. Okay, so it shows that yoga has potentially greater effectiveness than aerobics or any form of physical exercises. So yoga is it's always better for in terms when it comes to the patient care, because yoga is having a lot of components which is being involved in it. The one important component is the breath coordination. So what all exercises or what all practices we are teaching to the patients is being modulated with the breath coordination, and this breath coordination is having a direct or very greater impact on modulating the autonomic nervous system, which in turn have a very good modulation on your immune functioning, and immune functioning in turn will have a well control on the like prognosis of the cancer. Okay. And this is another very effective study which has been published by Dr. Raghavendra Rao, sir, who is the director of CCRYN during his time in the HCG hospital. So he has shown that the person who are regularly practicing yoga, okay, so in cancer patients, if they are regularly practicing yoga, their natural killer cell counts is been trying to maintain. So here you can see this dark black box, which tells about the natural killer cell percentage that is on the yoga group, that is in the black, and the control group, which is in the white. So you could able to see before surgery, the natural killer percentage was higher in the control group. After surgery, it drastically went down. And post chemotherapy, after post chemotherapy, the natural killer percentage cells were it's keep on getting reduced. But if a person is doing yoga, his natural killer cell level maintained before the surgery and even after the surgery. And after the chemotherapy also, there was a reduction, but it was not very high compared to the control group. So in this paper, they have quoted that yoga, the mechanism how yoga is internally working. Okay, so if a person is doing very effective yoga practices, his immune system is getting modulated. That immune system will help in which will work in hand to hand in reducing the cancer growth and the patient prognosis. Okay, so with all these kinds of evidences which has been created, okay, whatever I have shown, that is the systematic review, the meta-analysis, and certain powerful studies which is really going into the in-depth mechanisms of how yoga is working. This leads to a thing called the literature growth. There will be a surge in the literature growth. So any form of intervention or uh, uh, the things which needs to come into the clinical practices, the scientific world will accept those things only if there is a lot of research which is being published in that area. Okay, so all these things which has happened in, especially in the breast cancer population, have shown a very good literature growth, and these literatures is the one which will leads to create policies. Okay, these consensus or the policy statement is like creating an agreement between the researchers and the clinicians who will be dealing with the patients. Okay, so the researcher himself is not going to have a direct contact with the patient, but the clinician is the one who is going to have a contact with the patient. The clinician will believe the researcher, only if the researcher could able to create lot of evidences, if only a researcher, if he creates a lot of systematic reviews or meta-analysis or very good effective papers, and only if with those things the researcher and the physicians will make an agreement, and the physician will give the information down towards the patients, and patients will be start following. Okay, these guidelines or the consensus have been created in breast cancer. So this is a very good starting point for yoga, where the general body agreement have been made with the physician team and the researching team. So you can see these consensus are directed to the practitioners who treat patients, and this is the publications which that is the consensus which is being made. So you could able to see there is a very big association for oncologists, which is called the American Society of Clinical Oncology. This is one of the world's largest association, which has lot of cancer physicians inside. This association, on this association, there is a Society of Integrative Oncology. These people who on this, that's the Integrative Oncology team, they provided or they produced the evidence-based guidelines, and they presented these guidelines to the American Society of Cancer members. And in that consensus paper, they have highlighted that meditation and practices like yoga are recommended for anxiety and stress reduction. Meditation as well as relaxation as well as yoga is a very good approach for stabilizing a person's mood or depression. Also in this paper they have highlighted yoga is a very good approach, and it is we are recommending yoga to improve a person's quality of life who is been suffering with breast cancer. Okay, so you can note this paper, and when you are having time you can read. So like these kinds of consensus should be made for yoga in all kinds of disorders. Okay, so this is a paper only talking about yoga and breast cancer, but similar kinds of consensus or guideline paper should come in each fields, especially on lower back pain, diabetes. But it is coming, but still we need a lot of research which needs to happen. Okay. And one more consensus is also made in yoga for breast cancer, that is European standards. They also told that yoga can be a very effective approach in treating cancer-related fatigue in cancer survivors, and it helps in improving the quality of life. So with this, still researchers, they are working on these lot of side effects, which some side effects I have told in the beginning slides. But apart from that, you can able to see if a person is taking chemotherapy, starting from his head, that is from his hair till his toenail, almost all the organs and the system in his body is getting hampered with this chemotherapy. Okay, starting from A to Z, what all side effects you could able to line it, all these side effects the person will undergo. So yoga is a very effective approach in addressing these side effects which is happening because of chemotherapy. Also, these yoga approaches are very cost effective because it is going to reduce their medical bill to a 50%. And last thing is, it is also going to improve their prognosis at a faster rate. Okay, so I think I have another maybe 5 to 7 minutes in which I will just try to brush up what all the research evidences which has been created in survivors. Okay, so till now what we have seen is on patients, and this is about the survivors. So the primary thing is like it is like survivors means they are not completely free from the disease. Okay, this is what most of the cancer institute websites are also telling, that it is good, but also this phase of their life, that is the survivorship phase of their life, will be fruitful if they have taken considerable measures during the treatment time. Okay, for example, if they have if they have undergone any form of lifestyle interventions like yoga or naturopathy, any form of intervention during the time of their intervention, if they have done it properly, then their cancer survivor stage will be fruitful. If they have not done any form of measures, if they are if they were highly stressful, if they were not going for any kind of physical interventions or like walking or nothing, then their survivorship period will be a little question mark. Okay, so we will see what kind of issues they might be getting in the survivor stage and what all the side effects they might be receiving and how yoga can address those problems and what all the evidence which has been created. Okay, so this is statistics which is been taken in terms of cognitive problems. Okay, so when you see like patients who have been diagnosed with cancer, they studies have shown they will be having some problems related with their cognition. Okay, that is cognitive impairment. So studies have shown about 30% of participants will have this cognitive impairment even before they are starting any form of treatment. Okay, this is mainly because of the stress and anxiety what they had, what they will be having at the initial stages, also because of their lack of sleep and because of their lack of attention, which they you might be telling something but they won't be in a state to listen and comprehend the meaning out of it. So about 30% of participants will have this problem, and studies have shown this cognitive impairment will get worsened with the treatments what they will be undergoing, maybe chemotherapy or radiation, anything. Also, studies have shown about 35% of participants, the cognitive impairment in these participants, that is about 35% of participants, cognitive problem will get persisted even during the survival thing. That is even more than months or years following the completion of treatment. This much amount of percentage of population of people are getting this issue. Okay. And this is related with the cognitive problems, what is expected there. And when you look at the survivorship periods, so most of the side effects or the post treatment complications in cancer patients is purely dose dependent effect of chemotherapy. So the amount or the quantity or the effectiveness or the total dosage of chemotherapy what they have taken during the treatment phase will decide their survival time. Okay, so you could able to see that is after 10 years of completion of the chemotherapy, studies have shown 45% of people are prevalent to have autonomic changes, which has been shown in terms of reduced heart rate variability and reduced left ventricular dysfunction if the people have taken more than 500 mg milligrams of anthracycline. That is, anthracycline is a commonly used chemotherapy drug. So if the drug dosage what they have taken during their chemotherapy cycle, if it was very high, the chances of getting cardiac problems later in their life, that is even after 10 years of completion of chemotherapy, there is 45% of chances is there they will be having problem with the cardiac issues. And if less dose has been used, in spite of using less dose also, about 18% of people might have some problems related with their cardiac function. Okay, so even literatures say that in long term, the risk of death from cardiovascular causes is much higher than the tumor recurrence. Okay, so if a breast cancer or any cancer people is there, they will be coming out of the problem, but their death is because of the cardiovascular consequences, which might be because of the powerful treatments which they have undergone. So there is no other option. We need to undergo this treatment. During the treatment phase, if any form of lifestyle interventions has been clubbed, we could able to reduce all these forms of side effects which the person might get in the future. Okay, this is the thing which we want to highlight, and even this pictures has been well understood by the clinical population also. That is cardio oncology. That is a new department and the new wing and the new research area is being developed now, and they are much interested to incorporate some form of intervention while a person is undergoing chemotherapy. That is either using cardioprotectants during the chemotherapy time or using interventions like yoga or exercise or any form of traditional medicines which they could able to have a control on the chemo cycle so that their future will be better. Okay. So apart from that, I have told like the cancer survivor will have lot of symptoms which are listed below, which ultimately will be shown in terms of, one second. Hello, am I visible? Am I audible?
Yes, sir.
Yeah. Ma'am, I think it is 1. So can I extend for 5 more minutes? Maybe 3 minutes, 3 to 5. Is it okay?
Yes, sir, you can.
Yes, yes, sure.
Yeah. Okay. So all these problems, that is the physiological characteristics which is associated with the treatments and cancer per se, is, is going to reflect in terms of reduced sleep, their hormonal, they will be having a lot of hormonal therapy side effects, they will be having pain, vasculomotor symptoms, and immune function. Okay, and just I have listed what all research studies which has happened on cancer survivors using yoga as an intervention. So a lot of studies, that is most of the studies is being published in stress. Okay, that is the effect of stress on cancer survivors using yoga as a modality. Then the second most common is fatigue. Third is looking on the inflammatory conditions. And the fourth is like how cognitive functioning can be addressed. That is how cognitive impairments, which the person might be expecting in the future, can be addressed. Their sleep, how sleep could be improved, musculoskeletal symptoms, lymphedema, okay, and even menopausal symptoms. Now, when we look into the first thing, that is when we look into the effect of yoga for cancer survivors in terms of stress. So it is a well-known picture that they will be anxious even after completion of all kinds of chemotherapy, radiotherapy, which might be taking about 6 months to 1 year or even 1.5 years. They will be on the medications and treatment protocols. This is a huge burden for them. Even after completing that, they will be having a lot of anxiety about their health. The first anxiety what they will be having is whether the same tumor will reoccur. Okay, so that recurrence of the tumor is a very big anxiety which will be there within them, and the future and the primary concern for survivors. This is a very big mm, level of discomfort what the survivors were encountering, and yoga has been shown to address these anxiety or stress levels in these breast cancer survivors, so the chances of recurrence also might be low. Now we will, studies have shown how this anxiety might cause recurrence. Okay, actually there, the recurrence will not be there, but if a person is becoming more and more anxious, the chances of the disease to recur is much higher. Okay, so how it is higher is because it has been shown that there is the chronic stress or the chronic stressors which is created inside his body. On a long term, this will lead to a disruption in his immune system. That is, there will be a greater immune suppression will be there on these particular individual who is having more anxiousness, and there will be a dysregulation of the body's defense mechanism. So if the immune system is losing its control, the chances of recurrence or chances of getting any forms of infection or any metabolic related disorders, so it is like a gateway. So if more anxiety is there and if the immune gate is broken and if there is a dysregulation, the chances of recurrence are higher. So with interventions like yoga and lifestyle, we could able to address this anxiety so that we could able to have a modulation on a person's immune functioning, and the further consequences or the disease progression, anything can be arrested. So this is the beautiful mechanism which is being published by Dr. Raghavendra Rao, which I have shown in the previous slides, that he has shown that practicing yoga regularly will help the natural killer cell counts to maintain at the normal level. If natural killer cells are maintained and if your immune is getting in a modulated level, the chances of recurrence or chances of getting any further subsequent problems will be lesser. Okay. Also, yoga has been shown to have a good improved sleep efficacy. Okay. So because here what I have shown is that anxiety will ultimately leads to immune suppression. But during how this is happening, this anxiety leading to immune suppression, inside this pathway, multiple things are involved. One involvement is your sleep. If you have anxiousness and if you also have sleeping problem, your immune will get suppressed at much faster rate. Okay, so we need to address anxiety also, and at the same time we need to address a person's sleep as well. So since yoga is a form of an holistic approach, by addressing anxiety, we could able to address sleep also if you consider a person as a whole entity. So here you could able to see the blue line which denotes the yoga group and the yellow line which denotes the control group. So you could able to see the sleep quality in the yoga people is much higher. That is the percentage fold increase. Okay, you can see 0 is here and 10, 20, 30 is a percentage increase from the baseline. So here you see yoga people has about 25% increase in sleep quality if they practice yoga compared to the control, and you can able to see the sleep latency, that is if they go to bed how fast they will be sleeping. So here it shows that the percentage how fastly they are sleeping, yoga people sleep at a much faster rate. The sleep duration, you can see yoga people sleeps more time than the control. Their sleep efficacy is also more. The sleep disturbances is low in the yoga group, and the daytime dysfunction is in yoga group, it is the daytime dysfunction is actually getting modulated, and sleep medication use is being reduced in the yoga, whereas in the control group the amount of sleep medication use is also higher, and the subjective sleep quality is higher in the yoga group, whereas in the control group it is lesser. So overall it is telling that yoga, it is just, we are looking at the sleep in multiple dimensions. Okay, so global quality of sleep, this one point is more than sufficient. Like yoga improves a person's quality of sleep, which is going to improve his future things. Okay, and this is one more beautiful study which has been published in by the same team, Dr. Raghavendra Rao et al. And Dr. R. Amrit Anshuram, who is son of Dr. Nagaratna ma'am from SVASA. So they have done a beautiful study in HCG. So they are, this is just an observation study. They have just looked up two group of people. Okay, so one, this is especially on, this is on the survivors. Okay, so this is breast cancer people who have done yoga during their treatment phase, and this is group of breast cancer people who have not done yoga during the treatment phase. So here it shows that people who have done yoga during their chemotherapy cycle or radiation therapy cycle, at the time of their survivorship, okay, that is after completing all kinds of treatment, their general physical health is good compared to the this thing. And here you can see their stress levels. People in the yoga group, their stress levels were lower compared to people who have not done yoga. Their stress levels were higher. You can see their straight anxiety is low. In the control group, it is high. Their depression levels were low. So what this paper highlights is the importance of using yoga as an adjuvant approach during a person is undergoing the treatment. So if yoga is being incorporated as a integrated approach during the treatment phases, their survivorship will be fruitful. So this is the point which I am highlighting from the beginning. Like intervention should be started even at the time of chemotherapy phases. Okay, this study has clearly shown all these things. If yoga has been done at the initial state itself, their survivorship will be good, and if yoga has been keep on continuing even in the survivor state, their chances of or their lifespan also is will be getting improved. Okay, so this is one more thing which has looked in-depth analysis of the transcriptional factors, which is related with the genetics and this thing. So studies have shown that if yoga is being done, that is on a regular basis, so on the survivorship, the anti-inflammatory genes, that is genes which are related with the anti-inflammation, which is against the inflammation, in yoga group it is getting amplified. Whereas the pro-inflammatory, these genes which will make a person to get more inflammation. So those pro-inflammatory genes are getting down-regulated, whereas anti-inflammatory genes are getting up-regulated. So this clearly shows that yoga intervention could lead to decrease in inflammation-related gene expression and circulating markers of pro-inflammatory cytokines. So these kinds of evidence-based studies will create a lot of impact among the physicians, and their incorporation of these techniques, yoga, to their patient care will be much higher. So in future also, a lot of studies which should come with in-depth understanding the in-depth mechanisms. So in beginning, we have seen like yoga is helping, but in the last few years, if you could able to see, this is published in 2014. So these studies are trying to tell the in-depth mechanisms, how yoga is really helping. Okay. So one study have shown that natural killer cell counts are maintained. In this study, they are going into the next level. They are going into the genetic level, and they are trying to understand what kinds of genes are upregulated and what kinds of genes are downregulated. Okay. And this is one more good study. Here you can able to see the cognitive problems. Okay, the blue is the control group and the red is the yoga group. And this is at the baseline before treatment, and this is after the intervention, that is after the treatment, and this is their survival period, that is 3-month follow-up phase. So you can able to see people who have in the control group, that is in the yoga group, their cognitive problems have been reduced, and even at the follow-up also, even after the stage also, if they are practicing yoga, it is being reduced. But without the practice, again, the problems are getting hiked. Now you see only this red line that is in the yoga group. Here in the next graph, they have seen what kind of intensity of practice, if we do, we could able to reduce this cognitive problems. So here you could see if a person is doing not at all doing any yoga after the intervention, like it is again bouncing, the problems are getting heightened up. If a person is doing a less practice, it is the problems getting is reduced. But if a person does higher practices, that is, if they practice for longer duration and if they practice for longer days in a week, instead of doing 3 days a week, if they do 5 days or 6 days a week, depending on the intensity of practice also, the effectiveness of yoga is getting amplified. So this is a beautiful study which tells that if yoga is good, but if you do yoga on a regular basis with higher intensity, the effectiveness of this yoga is getting much more amplified. Okay. This is one more last thing. In this study, they are telling that the lymph, that is after breast cancer, removal of the breast tissues and other things, there will be lymphedema. There will be swelling of hands and limbs. So yoga has shown to reduce this limb swelling. Also, the range of movement and the grip strength in their hand is being improved. Okay. And this study is on, which is done on African women. Okay, because there might be a gender bias. Like most of the studies, what I have explained in the previous complete scenarios is being done in the Western culture and in the Indian culture. But when it comes to the African women's, so whether the same kind of intervention will have a global effect. Okay, that is the clinical significance behind the study. So this study is done on African breast cancer survivors, and in this study also they have shown yoga has very effectively worked even in the Black African cancer population. So yoga is having a very good global effect. It is like I will work for you, I won't work for you. It's not like that. Yoga is having a global effect which works as a very powerful entity for the entire globe. Okay. And apart from that, there are few qualitative studies also which has shown that yoga is a very effective approach. Like people used to tell, like I think yoga has helped me a lot in overcoming my problems. And they are telling that the stretch or the breath, that focus on your breath, means it is just their feedbacks. So what all this qualitative studies will be done in terms of interviews. So in interviews, what outputs they are giving. So two assessors will be there. So depending on both the assessors score, if it is matches, depending on that, the outputs will be published. So most of the people have told that yoga is a very effective treatment which has boosted their self-confidence, which has improved them emotionally, and which made them de-stressed. Okay. And also in the recent scenario, there is a lot of publications which is coming out using yoga intervention through the web streaming. Okay, that is post-COVID. Most of the things like physical contact has been lost, and even these kinds of studies, which is by looking at the TV monitor patients used to do, these studies also have shown that these yoga interventions were found to be safe, that results with no injury, and with these was very easy to use and also convenient to have the access. And future work is needed to understand the efficacy of these kinds of intervention in a much smaller scale. Okay. So conclusion. So overall, if you see, the overview of cancer is the most rapidly growing yoga research. That is, if you take yoga and if you consider the researches which is happening in yoga, in that yoga and cancer is a most rapidly growing field, and lot of evidence is being created in this field. Okay, that is yoga and cancer, and lot of multiple reviews and meta-analysis also been published in this particular field of yoga and cancer, and even consensus between the medical state, and that is with the large body of physicians is also, that is general medical agreements and consensus also been made with yoga and cancer. And most researches on this cancer has been done on breast cancer patients, and which we have seen before also, that mild and gentle or restorative yogas, pranayama, relaxation and meditation are the techniques which have been used in multiple studies. And most of the studies have used tailored practices, okay, depending on their, looking at their limitations. Because cancer patients are very fragile. One person might be flexible, one might not be flexible. The same practice might not be useful for him. So they have tailored the practice as per the patient's requirement, and most of the outputs have been taken. Often a regimented treatment protocol have been used, that is a well validated protocol, and most of the studies have used 1 to 3 classes a week, and many studies include looking at the brief home practices. And typically most of the intervention which has been used is about starting from 4 weeks to 24 weeks. So even if you want to convey the effectiveness of yoga to a general population, you can tell at least a person should do 4 weeks of yoga to see changes in them, and they can keep on practicing throughout their life. But research has been worked on looking at the effectiveness of yoga between 4 and 24 weeks of duration. Okay, thank you so much for giving me this opportunity. Thanks.
Any questions from students or participants?
If you have any questions, you can ask me.
Yeah, any particular yoga posture or position you recommend, especially for a breast cancer?
Yeah, ma'am. Actually, like, what is the concept is, as I told in the beginning, like, it should be of very relaxative poses. Like, for example, mild stretches. It should not be having heavy stretching practices where chest opening or heavy practices should not be there. But mild restorative practices is been recommended. For example, if you want to look for breast cancer, so in our treatment scenarios, whereas in the HCG or corporate setups, what they are doing is we will be doing mild practices like, for example, mild stretching of Tadasana with the proper breath coordination. So that is the thing. So practices can be done. It also depends on the person condition, like at what stage of surgery they are coming to us, and at what kind of chemotherapy they are undergoing. Everything is tailor made. So
Yeah. Thank you.
yeah.
Any other questions? So we'll wind up this session. I take this opportunity to thank today's guest speaker, Dr. Imberaj, for enlightening our students about integrating cancer and yoga care. On behalf of Yenepoya Naturopathy and Yogic Science College and Hospital, I extend my heartfelt gratitude for spacing your valuable time for us. Thank you, sir. I also thank students participants for attending this webinar. I thank IT department for this smooth functioning of this event. Last but not the least, I thank each and everyone for making this program a successful one. Thank you, sir.